Hey everyone, welcome to the second episode of the H2O Stories podcast, brought to you in partnership between Tayaba and Bayer Pakistan. My name is Misha Khan, and I am the manager for blockchain research and communications here at Tayaba. So we are hosting the second podcast series on none other than World Health Day. And so the title of this episode, which is Water, Wealth for Health, does reflect that. So essentially, what we want you to take away, or what we were sort of thinking about when thinking about health and water, was how water is a form of wealth for those with rare access to it, while in abundance for others who have ready and instant availability. So I don't want to take up anyone's precious time by going on myself. So let's just move on to introducing our lovely speakers for this session. We've got Hafsa Zubair from Bayer Pakistan, who you may remember from the last session, and Dr. Nabeela Shahid from the National Rural Support Program. So Hafsa, why don't you tell us a little bit about yourself first, and then we'll go on to Dr. Nabeela.
Hi, Misha. Thank you. For our audience, hello and Assalamu alaikum, everyone. My name is Hafsa Zubair, and I look after communications, public affairs, and CSR for Bayer in Pakistan. So Bayer is a life science company, which, as the name suggests, means that we are in the business of the science of life. And of course, that includes a very strong focus on health and healthcare, which makes the fact that we're having this discussion on World Health Day 2022 very apt. Bayer's global vision is literally health for all, hunger for none. And I also just wanted to mention here that this year the theme for World Health Day is health promotion for well-being, equity, and sustainable development. So, a really good tie-in. Looking forward to the discussion.
Great. Thank you so much. Dr. Nabeela, why don't you tell us a little bit about yourself and the fascinating work that you do with the National Rural Support Program?
My name is Dr. Nabeela Shahid, and I'm working as a Deputy Program Manager, Social Sector Services at NRSP Head Office, Islamabad. And as you know, that NRSP is working in 72 districts all over Pakistan, and we are working at grassroots level with organized communities. So far, we have organized 3.74 million households. So in social sector services, we are implementing projects related to health, education, and wash. And in health, we are implementing projects related to family planning, malaria control program, immunization, access to safe drinking water, waterborne infections, and other diseases like TB, etc. Education, we are working in education, we are working for the enrollment of children, specifically the primary education. And in WASH, we are educating the communities as well as working for the nutrition specific and nutrition sensitive initiatives related to WASH and agriculture.
Yeah, I know. Wow, that list of initiatives is so comprehensive and, very impressive. You guys, I think, have covered all your bases in terms of health. Right. So H2O stories, let's get right into it, shall we? So this time, instead of me telling you guys a story, I'm going to show it to you. It's a small and insightful documentary which Tayaba has made. So without any further delay, let's take a look.
ਅਸੀਂ ਸਾਰਾ ਦਿਨ ਪਾਣੀ ਭਰਦੇ ਹਾਂ 30-35 ਕਿਲੋ ਦਾ ਮਟਕਾ ਹੁੰਦਾ ਜਿਹੜਾ ਭਰ ਕੇ ਲਿਆਉਂਦੇ ਹਾਂ ਤੇ ਇੰਨਾ 5-6 ਕਿਲੋਮੀਟਰ ਹੈ ਜਿਹੜਾ ਸਫ਼ਰ ਹੈ ਜਿਹੜਾ ਅਸੀਂ ਕਰ ਤੇ ਜਾਂਦੇ ਹਾਂ
3 ਦਫੇ ਅਸੀਂ ਪਾਣੀ ਭਰਦੇ ਹਾਂ ਕਵਰ ਪੀੜ ਕਰਦੇ ਨੇ ਮੋਢੇ ਪੀੜ ਕਰਦੇ ਨੇ ਗੋਡੇ ਹੁਣ ਦਰਦ ਕਰਦੇ ਨੇ ਟੁਰਾ ਨਹੀਂ ਜਾਂਦਾ ਹੁਣ ਬਹੁਤ ਹੀ ਸਾਨੂੰ ਤਾਂ ਮਸਲਾ ਬਣ ਗਿਆ
पानी का मटका भरन गई से दूरों ते मज्जां आंदियां पियां सन उन्हां मारा धक्का ते ਇਹ घड़ा ਵੱਜਿਆ ਖੂਹ ਵਿੱਚ एवें ਵੱਜਿਆ ਤੇ ਇਹ ਲੱਤ ਮੇਰੀ ਸਾਰੀ ਟੁੱਟੀ ਹੋਈ ਹੈ ਮੈਂ ਮੁਤਾਜ ਆ ਪਾਣੀ ਦੂਰ ਸੀ ਤੇ ਪੀਣਾ ਤਾਂ ਹੈਗਾ ਸੀ ਇਸ ਪਾਣੀ ਬਗੈਰ ਤਾਂ ਗੁਜ਼ਾਰਾ ਹੋ ਨਹੀਂ ਸਕਦਾ ਇਹ ਪਾਣੀ ਪਿੱਛੇ ਟੁੱਟੀ ਇਹ ਪਾਣੀ ਵੀ ਟੁੱਟੀ ਹੈ ਬਿਲਕੁਲ ਜੇ ਨਾ ਘੜਾ ਚੱਕਦੀ ਤੇ ਕਿਉਂ ਲੱਤ ਟੁੱਟਦੀ ਮੇਰੀ ਤੇ ਇਹ ਦੁਆ ਹੈ ਵੀ ਪਾਣੀ ਨਾਲ ਕਿਸੇ ਨੂੰ ਤਸਾ ਰੱਖੋ ਇਹ ਮਟਕਾ ਤੂੰ ਜਾਣ ਛੱਡੇ ਇਹ ਮੇਰੇ ਨਾਲ ਮਟਕਾ ਵੱਜਦਾ ਤੇ ਮੈਂ ਕਿਉਂ ਐ ਜੀ ਹੁੰਦੀ
ਜਦੋਂ ਅਸੀਂ ਬਿਮਾਰ ਹੋ ਜਾਂਦੇ ਹਾਂ ਉਦੋਂ ਅਸੀਂ ਕਿਸੇ ਗਵਾਂਢ ਨੂੰ ਆਖਦੇ ਨੇ ਕੋਈ ਬੱਚਾ ਖੜਾ ਹੋਵੇ ਜਾਂ ਕੋਈ ਖੜਾ ਹੋਵੇ ਉਹ ਭੇਜ ਦੇਵੇ ਪਾਣੀ
वो कल शाम टाइम पानी भरने जाते उधर मैंने स्कूल काम लिखना देर हो जाती
ਬੱਚਿਆਂ ਨੂੰ ਵੱਜ ਜਾਂਦੇ ਪੈਰ ਤੇ ਸੱਟ ਲੱਗ ਜਾਂਦੀ ਬੱਚਿਆਂ ਦੇ ਛੋਟੇ ਛੋਟੇ ਕਾਦ ਰਹਿ ਜਾਂਦੇ ਨੇ ਸਹਿ ਮੁਸੀਬਤ ਸਾਨੂੰ ਇਸ ਪਾਣੀ ਵਾਲੀ
Now that we've seen the H2O story for today, let's talk a little bit more about health and some of the ways that it links with well-being, economic, and educational opportunities, shall we? So today we're lucky enough actually to have both the corporate and non-profit perspectives with us. So I'd like to hear more from them. Dr. Nabeela, can you tell us a little bit about the non-profit side of healthcare? What are some of the key health indicators in rural communities? Or alternatively, what sort of health problems have you seen working with rural communities, especially related to water?
Like if we talk about the issues in the rural communities and what are the health indicators. So mainly, you know that in rural areas, there is low literacy level, bad sanitary conditions, and they are like oral open defecation and orophycal contamination of water. So these are the main issues. And there is also overcrowding due to family planning practices are not being adopted in those areas. So the health indicators, mainly if we talk about like life expectancy, it's the main indicator plus the infant mortality rate or the maternal mortality rate, the neonatal mortality rates, access to safe drinking water. So mainly if we say that 40% of the total burden of disease is due to the communicable diseases, which are mainly the diarrhea and dysentery. And among the deaths of the infant mortality rate, 60% of the deaths are related to diarrhea. And 53,000 under 5 children, they die every year because of these diarrhea and dysentery diseases. So it's a huge chunk which is covered due to this waterborne infections. And we can address these deaths and these issues through provision of safe drinking water. So when we started the assessment for this H2O wheel, we found that the communities had to walk more for around 5 kilometers to reach to the water sources and bring water from there. And 90% of the households, they didn't have the access to water for their household use, even for their household use. So it was quite challenging in those areas, and there was all brackish water and which was unfit for drinking. And mainly the women and the children, they were engaged for bringing the water. So if the health implications were in addition to the scarcity of water and the bad sanitary conditions for the children and the whole family members. Specifically talking about children, if we talk about children, then there are like neck or the spinal issues, injuries to weight bearing, and there were musculoskeletal disorders, which were leading to degenerative changes. And the children who were initially healthy, they used to become disabled after such time because of the frequently bringing and bearing the weight on their heads. So it was like a great issue for the communities as well. And I think investing in water that would decrease, investing in such initiatives like transportation through better means would be something good. And the main diseases which include the waterborne infections and the water-washed infections. The waterborne are, as you know, that there are like amoebiasis. There are multiple bacteria, parasites, and viruses which are carried in the water, which is mainly due to the bad sewerage system, because the fecal water that mixes with the drinking water and that goes into our bodies, and leads to diarrhea, dysentery, cholera, amoebiasis, typhoid, and such diseases, and worm infestation as well. And due to frequently the children, specifically under 5 children, they are having frequent dysentery or diarrhea, then the intestinal walls, they are damaged, and that leads to malnutrition or stunting and wasting of children. So in that case, that is the waterborne. For water washed, like if we are having bathing and washing our faces with the contaminated water, then it results with skin infections and eye infections. So there are multiple issues just because of one reason, which is the contaminated water.
Right, absolutely, absolutely. I think water makes health such a multifaceted issue. It's not just about the diseases that you get if you drink water. It's also about, well, skin diseases that you may get from bathing in that water, etc., like you mentioned, or even carrying that water, and all the sort of musculoskeletal problems and long-term disabilities, especially in children. So thank you so much for giving us that 360 view. I think we really needed to hear that today. So now let's move on to Bayer. Let's see what they have to say. Hafsa, so can you tell us a little bit about how you think corporates can make tangible improvements in people's health? So essentially what I'm asking you is, where is the intersection between business and the betterment of lives? And can a company essentially strive to do both?
Well, I think that's a great question. The intersection between business and betterment of lives is an increasingly important focus for a lot of companies. In the case of Bayer, being active in two of the most critical areas of importance today, globally, healthcare and agriculture, it means we're already uniquely poised to contribute. Because and that's through our portfolio. So that's on the business side, where, for example, Bayer's portfolio is uniquely structured to offer solutions for both healthcare and nutrition. We have our pharmaceuticals division, which offers products to treat a variety of medical conditions. Then we have our consumer health portfolio, which offers products for well-being and self-care, and just generally promoting better health. So on the business aspect, we're already sort of dealing with those challenges. But beyond business, corporations like Bayer are increasingly aware of how they can bring about real change and make a real impact on people's lives on the ground. So that that intersection between business and improving lives that you're talking about, we're already at that crossroads. When it comes to sustainability and long-term goals, for example, Bayer has made some ambitious commitments. We have global targets about enabling smallholder farmers across the globe, or providing contraceptive access to women across the globe. So you can see from that, that companies like Bayer are already building these social commitments into their strategy. So absolutely, yes, a company can strive to do both. And I think Bayer, for one, definitely already is trying to do that. And another area where we can make focused, targeted contributions to improving lives is with our CSR interventions. And you know this, that in a developing country like Pakistan especially, I think companies have a very real opportunity to contribute to betterment of lives, where we can support infrastructure and we can support initiatives that can plug some of the critical gaps in existing systems, whether it's infrastructure or whether it's capacity building or even education and awareness.
Right, great. Thank you so much, Hafsa, for that enriching perspective. Before we close off, I would like for both of you to give our viewers some conclusive remarks or a nice message on World Health Day. Hafsa, why don't you go first?
Well, I think we cannot overstate the importance of water availability and the crisis that is in place when water isn't available. Like we've already heard, Dr. Nabeela has already explained quite a bit about the fact that prolonged water stress is going to have devastating effects on public health and economic development. And of course, Pakistan being an agriculture-based country and a developing nation at that, water scarcity doesn't just pose immediate dangers to the population and to food security, but also long-term threats to our food security, public health, and so on. And also, like we've heard, communities facing this kind of water access and water scarcity are at higher risk of diseases. We have malnutrition, stunting, and wasting. You have waterborne diseases, and other chronic illnesses that really, really impact the public health, and then of course also economic development. So and we know of course that our population lacks access to basic healthcare resources and facilities, and lack of education is also part of the problem. You have urbanization and overcrowding. So these are all such a complex issue, and these are all factors that add to it. So I think all of these ground realities are part of the reason why we made the decision to collaborate with Tayaba, for example, on the H2O water wheel project. So, at least we can know, Bayer as a company can know that over 14,000 people last year have experienced a positive impact in their daily health and well-being through the distribution of these water wheels. And I think going forward, like on World Health Day, I think we're already looking at all the ways that we can continue to contribute to improving public health. And really urge anyone watching to do the same.
Right. Thank you, Hafsa. And Dr. Nabeela, before you give your closing remarks, I'd also like to ask you if you noticed any improvements in the health conditions in these communities over time, and especially after relevant interventions have been made from NGOs like yours and ours, or corporates with their CSR initiatives like Bayer. So yeah, if you could just tell us a little bit about that, and then give us your closing remarks, that would be great.
Yeah, it was a great opportunity for collaborating with the Tayaba organization, because NRSP was already implementing the WISE program, which included the access to safe drinking water, immunization, and solid waste management with enrollment of children. So by collaborating with Tayaba organization, we were able to benefit the communities of the rural areas, especially those who were very poor and they were having income only from 1,000 to 17,000 per month, which was even below the average salary. So for those, it was like now after few months we visited them, and they were very happy because they were satisfied and happy due to their different health implications they were earlier facing. Now they were feeling less tired, as well as they had the monetary benefits, plus they were more productive in the sense that they were giving time in their health chores or normal household chores, as well as the men were also more productive in the sense that they were going regularly on their jobs, because earlier they had to spare time from their jobs as well. Plus the children, they were also focusing on their education as well as their physical recreational activities, rather than by force going and bringing the water. So it was plus the earlier they had the medical ailments due to waterborne infections and the frequent diarrhea and the expenses they were bearing earlier on these medical ailments. So that was also reduced. So in the sense, it was like after a few months, we would be able to see better effect in terms of improvement in the quality of life. That would be because, as the research has also shown, that if we invest $1 in water or toilets, then it returns to $4 in the economic productivity. So it has been proven as well through this initiative, because by giving us such an innovative idea of providing these wheels, the communities are able to transport water without carrying it on their heads. So it's like quite beneficial for those communities.
Right, definitely. Yeah, I was just thinking about it. It just sounds to me a lot like, the butterfly effect. A small action leads to, a whole chain reaction of meaningful outcomes, right? So thank you, Dr. Nabeela, for really sending that message home. Thank you, Hafsa, for joining us as well. So thank you to both of you for coming and, being part of this particular podcast on World Health Day. I think we talked about some things that were truly important. It was lovely hearing from you both. I know that I learned a lot. And before I go, I would just like to add, water and health are inadvertently linked. So you can't have health without water, which is why it was so important for us to do this podcast for World Health Day as well. So thank you, Hafsa and Dr. Nabeela, for really sending that message home. And thank you to everyone else who tuned in. As always, we hope that you enjoyed and learned something new in the process. Do tell us what you think about the podcast in the comments below. And if you like what you saw, do share with your loved ones. That's all from me. Take care, everyone. Allah Hafiz.